So guys, for the next thing, we are looking at what is known as visceromegaly. So visceromegaly is enlargement. Viscerals are organs, right? So there's enlargement in the organs. All right, visceromegaly. All right, enlargement in the organs of a fetus. So visceromegaly, you can see, enlarged kidneys, enlarged bladder, enlarged, hydronephrosis, that's enlargement of the urethra. So enlargement in different organs in different parts of the body. We are not being specific on any organ here. We are just having an introduction to the concept so that you know that something like this exists. So enlargement of organs like the heart, the liver, and spleen. Of course, when they are enlarged, it shows you that there's a problem. You understand? So it's something that when you see it, it will now trigger you to do further tests, to do further examination, to do further investigation. So possible things you can be suspecting when you see that the organs of a baby is enlarged is things like congenital heart defect, fetal anemia, right? Twin-to-twin transfusion syndrome, fetal arrhythmias, fetal hydrops, right? So fluid accumulation in the fetal compartments. Okay, so enlarged liver and spleen. Okay, that means what? Okay, this is enlarged heart. Sorry, we're talking about the enlarged heart. Okay, these are things you should be suspecting for enlarged heart. You understand? So if it is enlarged liver and spleen, you can also be suspecting things like infections from Cytomegalovirus, syphilis infections, toxoplasmosis infections, parvovirus B19 infections. All right, then you can be suspecting fetal anemia. You can be suspecting genetic disorders. Okay, like all those glycogen storage diseases, Niemann-Pick disease, Gaucher's disease. Then also the Beckwith-Wiedemann syndrome. You can be suspecting this. The transient abnormal myelopoiesis. You can also be suspecting this. So clinical significance. These findings may be as a part of fetal hydrops, which is a condition where there is accumulation of fluid in the baby. You understand? It's usually associated with you having enlarged organs, right? All right. Fetal morbidity and mortality may also be associated depending on the underlying cause. Early diagnosis is crucial for management. All right. You pick it up early, they start giving it early attention. You pick it up late, it leads to complications already. Okay, so that's just what fetal enlargement entails. Fetal organ enlargement.